This is Laurie McGraw, and I am speaking with Dr. Robin Berzin, who is the CEO and founder of Parsley Health, which is a new way of delivering care for chronic illness patients who have very complex conditions. And so Robin's going to tell us about this because this is a very costly part of healthcare where people don't get the access and relief that they need for dealing with multiple complex conditions. Robin, I'm so excited to be speaking with you this morning.
So honored to be here. Thank you so much for having me.
Well, great. Well, this is a collaboration that Inspiring Women is doing with 7Wire, where I'm speaking with several of the exceptional women leaders of their companies. But Robin, let's just get started. As a physician, you started Parsley Health in 2016. So you're already doing the hard and important work of seeing patients, but then you wanted to deliver care in a new and different way. Maybe give us a little bit of background around that.
Sure. So I'm a physician. I trained at Columbia Medical School and Mount Sinai Hospital for internal medicine training here in New York City, where I live. And what I noticed in my training was something that really bothered me and stood out to me. And it was that, the majority of the patients I was treating day in and day out in the hospital, in the clinic, had chronic conditions that people are living with for years, if not decades. And in fact, most of the people who have those conditions have 2 or 3 or 4, not just one. And yet it was clear to me that our healthcare system really isn't a healthcare system. It's a disease care system. And for these patients living with chronic conditions, I watched them just spinning through a revolving door. And that revolving door was spinning faster and faster while patients got sicker and sicker, spinning between primary care and specialty care. And what I saw was a system that wasn't designed to help these patients get better. In fact, 60% of American adults have at least one chronic condition. 30% of American adults, this is about 100 million people, have 2 or more chronic conditions that are driving 75% of rising costs. And most of these conditions are what we call risk adjustable. What does that mean? It means they can actually get better. I knew there was a form of medicine called root cause medicine that was designed to help people get better who had these types of conditions. And so back in 2016, I piloted a clinic to see if we could start to do that and to sort of template what could be something that could really scale. And here we are.
Well, let's just talk about what is different, because the statistics that you're talking about, the chronic conditions, the rising costs that go with those chronic conditions, solving this problem is massively challenging. Why isn't what I'll just call normal medicine set up to take care of this problem? Why do we even need Parsley Health? And I want to talk about what you're doing that's so different, because you've got great results.
So Parsley Health is the pioneer and the nation's leading provider of root cause medicine, which really just means, what do? We find and treat the root cause. I'll give you a simple example. Everyone on this call could have a migraine headache. A migraine headache could be caused by a dairy sensitivity, a magnesium deficiency, an imbalance in the hormones in the menstrual cycle, too much caffeine and poor sleep, right? There's lots of root causes for a migraine. Turns out, though, that none of the root causes is a painkiller deficiency. So when we use a painkiller to manage a migraine, we do help the patient, and that's important. Pain management is so important. But when I look back at my training, even at top and absolutely wonderful institutions, I was trained to manage a migraine. Here's a painkiller, and then a different kind of painkiller, and then a neurologist and Botox and a headache center. And now we've lost all the days of work and we've spent all this money, and yet the patient still has the migraine. And so at Parsley Health, we have codified and scaled root cause medicine. We do a deeper clinical history going back to childhood. Sometimes the thing you have today started a long time ago, and we need to look into the past to understand where you are. We also do smart diagnostic testing. We connect the body as an ecosystem. Sometimes what's happening in your gut is causing your skin rash or your brain fog. And then we also look deeply at your social determinants of health. What are you eating? How are you moving? How do you manage stress? Do you have meaning and purpose in your life? What is your willingness to change? These things deeply impact how you feel right now and your health trajectory. And yet, in the conventional care model that I was trained in, I didn't look at any of the data that I just listed. None of it made its way into my algorithm as a doctor to prescribe and treat. And so at Parsley, we've built a health risk assessment. We've built a system that dives deep into all of that data, along with things like what conditions do you have? What are your symptoms? What medications are you on? And so forth, all the basics. And we bring all of that together in a much more comprehensive and holistic, and frankly, more pointed treatment protocol. So when it comes to our migraine, if we help you, we determine that your migraine is triggered by dairy and we help you find dairy alternatives. Well, wow, there goes away the painkillers and the neurologist and the Botox and the headache center and the lost days of work. And we've saved $10,000 in 1 year, right? So every patient deserves a provider who can spend time with them, who's trained to do a root cause analysis, who's trained to work with this data set, and who's trained to prescribe holistically to treat the root cause. Because what we know is that if we don't change the medicine, we won't change the outcomes.
Robin, I want to like double click on that time component, because what you just went through, that sounds amazing to me, you know, to go through all of those different factors and get at the root cause of whatever might be the particular issue I would come to see a physician for. But first of all, when I go see a physician for what I'll call a routine type of issue, or maybe I have something that's flared up. First of all, getting in to see a physician, a primary care physician, that's really hard. And I'm on wait lists, and I'm on wait list to get on the schedule to get on the wait list, kind of thing. And then when I get
wait list.
Yeah. Yeah. And then I like 15 minutes after filling out quite a few forms ahead of time that may or may not be read or used in the visit. So first of all, like if I came to Parsley Health and you're in your clinic right now, your beautiful clinic, how much time would I get with you? How much time would I have at a Parsley Health site? Because it sounds very different than what I'm experiencing when I see a physician.
Absolutely. Our first visit with our clinician is an hour long.
Wow.
We don't have a 15-minute visit because, if you're super healthy and you just need a quick thing, a 15-minute visit is totally fine. But for 30% of American adults who have 2 or 3 or 4 health complexities, 15 minutes is a joke.
Yeah.
And as a result, we are only able as providers, right? I've worked in that system myself. I'm an internal medicine trained doctor. We're only as providers, all we can do is triage, refer, refill, triage, refer, refill. And we send people through the windmill, and it's not working. I hear every day from our employer clients, our health plan clients, and from patients, healthcare is getting more and more expensive, and yet our population is getting sicker and sicker.
Yeah.
Time to take a step back and say that what we are doing is not working.
Yeah.
And the idea that we can't justify the little bit of extra time to deep dive with a patient, to connect the dots across body as ecosystem, across environment and social determinants, to understand what's driving their conditions and what could be the unlock for them. The thing is, Parsley, we do have that time, and Parsley Health has proven it.
Yeah.
Our independently validated actuarial data shows that we reduce total cost of care by 32%. And we do that through the root cause methodology, through spending more time with our patients, and of course, through meeting patients where they are. I'm sitting in our clinic in New York. We have another beautiful clinic in LA, but actually we're 50-state virtual clinic, and we work with patients all across the country who don't have to leave their home or their office to work with us. They still get that time, they still get that personalized care, and they still get a board certified doctor who's trained at Parsley in our in-house fellowship in root cause medicine. So it's care that you can't find anywhere else.
How do I get to Parsley Health? So so your customers are employers, are payers. So first of all, like, how does your business model work?
Okay.
And then how do I, as a consumer of healthcare, get to see someone at Parsley Health? Do I have to qualify? What does that look like?
So anyone can sign up for Parsley Health across the country. We're actually open to individuals. This is what makes Parsley really unique. We have three channels of our business: direct to consumer, payer, and self-insured employer. So we're having some of the biggest employers in the country, some of the employers who are named as best places to work in America, sign on to add Parsley Health as a benefit, which is so cool and so gratifying and exciting. That was always my mission, to get this kind of medicine into the hands of the people who needed it most. And our employers, who are so innovative, who are really, I think, moving the needle in our healthcare system in a way that is so desperately needed, are saying we need medicine that works.
Yeah.
We need not another PCP solution, not another point solution, right? That fragments care and silos our patients. We need something truly different, especially for those folks in our teams who are high cost and complex. Those people for whom their health is their second full-time job. They're not getting what they need from the existing system. Some people are, but there's this other group that's quite sizable who are not. Employers really see that. Health plans really see that. This fall, we won the Traction Award at EHIR, Employer Health
Congratulations.
Roundtable, and HPIR, Health Plan Innovation Roundtable. We won 2 Traction Awards this fall. And I think it's because this story, plus our incredible outcomes data, are really resonating with the folks who are on the hook financially for our healthcare, and are really trying to change something. In addition to that, it's expensive to be sick for the average person. Health insurance is expensive. A lot of things aren't covered. And so what's unique about Parsley is we actually started out as a direct-to-consumer company. And what's so exceptional is that people, tens of thousands of them across the country, have chosen to pay out of pocket for Parsley because this kind of care is so exceptional and needed. And I think that is a real testament to the fact that at the end of the day, whether you're selling to health plans, whether you're selling to government plans, whether you're selling to employers, whether you're selling through any channel, if you don't have a service that regular people need and want, it doesn't matter. And we proved that first in our consumer business, which we still have. And now we've expanded quite rapidly into health plans and employers.
Well, the financial outcomes, the 32% reduction in costs, are amazing, but perhaps to me, even more impressive are the actual results with patients. I mean, just reading through some of the information about Parsley in terms of 60% of patients seeing dramatic improvements in outcomes, managing complex conditions in a really short time period, just sounds exceptional. I mean, certainly it sounds wonderful to have all of that great time with a caring provider, but then to actually make improvements. One more question about just sort of the care delivery. I mean, you wrote your book in 2022, Prescription for Happiness: How to Eat, Move, Supplement for Peak Mental Health. So you incorporate mental health, but you also incorporate a lot of diet, and the additional focus on social determinants. I'd love to just talk a little bit about food as medicine. That's sort of a new thing right now. It's kind of a surprise that it's a new thing, knowing how integral nutrition is to actual health. Can you just talk about that component of the Parsley Health formula?
Yeah, absolutely. Well, food is the first thing on our prescription pad. We prescribe drugs, we refer to specialists, but we also prescribe highly personalized nutrition protocols. And I want to be clear, this isn't lip service to eating healthy. A lot of the food as medicine programs I see out there are eat healthy, don't eat bad things, right? And that's not helpful.
Yeah.
I don't care whether you are north, south, east, west, young, old, rich, poor, highly educated, not highly educated. We have a very low level of health literacy in this country. And most people, in fact, 94% of Americans eat an ultra refined diet. And so I remind people, food isn't like medicine, it is medicine. And if you eat the SAD, Standard American Diet, acronym SAD, you will get the standard American diseases. And so highly personalized and specific doctor prescribed nutrition protocols are where we begin. Because for many people with high blood pressure, high blood sugar, migraine headaches, autoimmune conditions, hormone imbalances that then lead to infertility, food is actually one of the key triggers and drivers for those conditions. And this has been well established for decades, and yet we only give about a couple hours of nutrition education during medical school. I can
Right.
personally attest to this. And we haven't taken food seriously, and yet food is our first drug. Exercise is our second drug. And these are highly evidence-based protocols. And so when I wrote about in my book, Prescription for Happiness, is the tie-ins between our physical health and our mental health, and how oftentimes we tackle mental health with this concept that it's all in our heads. And yet sometimes our mental health is actually starting in our bodies. We're able to help our patients get off of chronic prescription drugs like SSRIs and SNRIs and other antidepressants. Not always, sometimes those drugs are really important. But for a lot of people who just started those drugs, maybe through a well-meaning provider, but no one really dug in. I can't tell you how many women have been told that their depression and their weight gain and their digestive issues are all in their heads,
Yeah.
psychological, and no one did proper thyroid testing.
Yeah.
Ridiculous when 1 in 5 women in our country will be diagnosed with a thyroid condition in her lifetime. And so when you test holistically, when you are trained as a provider to lever food as medicine the same way you would lever a drug, you end up with a more powerful and poignant and effective protocol for a patient who's suffering from chronic disease. We can help somebody eliminate their anxiety or depression. We could just help give somebody a leg up in addressing those conditions by addressing things like sleep and nutrition as part of their overall prescription.
Robin, I'm really excited about your model. And I'm also excited about the way that you're very focused on scaling it nationally, making it a virtual clinic for all 50 states. That's incredible. And you also did this great study, the state of health of women in the workforce, talking about not just women's health, but how addressing specific issues of women have enormous economic benefits for employers. So that was incredible. But there's so many things that I'd love to talk about from what you're doing at Parsley. But maybe I could just hone in a little bit on what it means to be a physician entrepreneur, a CEO, a founder, and what that journey looks like. We all know the statistics in terms of women founders and CEOs. There's not enough of them, but the ones that are there who are succeeding like you, they're also receiving a paltry 2% of available funding. So I would just love to get from you sort of like, what does that journey look like for you? You are successful at building this business, and any maybe secrets you could share with other women leaders who are aspiring to do the same.
I think as a woman and as a physician, which are also as a combination a rare thing to start a company. For my journey really started with a pilot practice of my own. I had co-founded one startup during medical school. So I actually had some startup experience. I'm the co-founder of a company called Curator, which is still going strong. A buddy of mine in med school started that company, and that is an app to help medical providers and care teams with medication reconciliation and clinical decision-making in hospitals mainly. And that was really my first exposure to building technology for healthcare, to the idea that we could build something scalable that could impact patient care and safety everywhere. And then starting Parsley was really for me about this personal passion for what I shared earlier, what I had observed in my training, that we had this gap for patients with chronic conditions that was really costly to our system. And it felt like there was a really clear way to fix it if we could build a scalable root cause medicine system. So that was probably my inspiration. But when I got started, in 2016 and 2017, I bootstrapped the company. I didn't take a salary for a year and a half. And, I looked around at many of my male peers and startups who day one with an idea and no revenue, went out and get their companies funded. And I didn't have those connections. I didn't have that confidence. I didn't know how to raise money. And so I really built something literally from zero, from the ground up. I joke, but it was not really a joke. It's true. I was ops, legal, marketing, tech, HR, also the doctor. I hired 2 part-time health coaches when we opened our first clinic and told them, we have 3 months of runway from people who signed up for the program before we opened. And I don't know if I'll have a job with it for you in 3 months, but if you're willing to give this a whirl, come on board.
Yep.
And one of those women is our director of health coaching and still with me at Parsley to this day. So it's really an incredible trajectory. But I think for women, what I would say is, don't let that feeling that, you're not as connected, or you don't know the rules of the game, or you're not, don't feel like you can go out and raise $10 million on an idea, which is what I saw happening around me in those days. Don't let that stop you, right? Start somewhere, get a proof of concept, build something. And that's a really important step, I think, because the startup trajectory, no matter who you are, man or woman, no matter how you identify or where you live or how good you are at raising money, the startup trajectory is really hard. It requires incredible resilience. It requires, as I like to say, one of my friends is a great entrepreneur. She always says, today is the day you got to put your big girl pants on and just address and deal with whatever's in front of you. And those things are not always clear or easy or going your way. And so if you can get that proof of concept and prove to yourself first that you are so passionate about this idea that you're going to have the resilience to keep going, that is going to matter so much more to your long-term success than, the size of the check that you raise to start or the valuation that you get. And I think the current market is really proving that a lot of the, big fundraises and big valuations and the things that for a few years were sort of de rigueur and everybody felt, I remember that in 2021, it felt like everyone around me was raising $100 million on 5 million in ARR. And I was like, what's going on? I don't understand this. And I, Parsley raised a strong Series C in that environment as well. But I just remember reading the headlines every day and feeling so bad about myself, feeling like, well, what's wrong with me? Why am I not doing this? What's going on? And now we look back at that time and see how out of scope and destructive it's been for companies. And, I think the other advice I would give is don't pay attention to the noise and the press and what's going on around you. Focus on you, focus on your business, building a high quality business with great metrics. And that will enable you to continue to raise.
Robin, I think that's just a great thing for us to close out on because, it does take more than just passion and a great idea. Focus on resilience, building a great metrics focus, and of course, in the case of Parsley Health, the outcomes that you're delivering. I think those are key ingredients for a successful company. This has been an excellent conversation. I so appreciate this time with Dr. Robin Berzin, who is the CEO and founder of Parsley Health. Thank you so very much, Robin.
Thank you so much.
This has been an episode of Inspiring Women with Laurie McGraw. Please subscribe, rate, and review. We are produced by Kate Cruz at Executive Podcast Solutions. More episodes can be found on inspiringwomen.show. I am Laurie McGraw, and thank you for listening.